Chapter 10, Therapeutic Communication. Chapter Objectives. So communication is not something that is actually precise. There's many different times that messages can be misunderstood or communication can be lost. Remember that communication is an interaction between two or more people. It involves the exchange of information. As nurses, we are to practice therapeutic communication based on our nursing principles. Two people talking is a very simple explanation of interpersonal communication. So if another person wanted to understand what was being said, would it be enough to just read the transcript of the conversation? No, it would not. Communication is actually complicated. It involves content and context of the message, as well as the perceptions and the values of both the sender and the receiver. Intrapersonal communication takes place within oneself. It's often referred to as self-talk or self-dialogue. Conversations that we have with ourselves when we solve problems, making plans, or reacting emotionally, these are intrapersonal communications. These actually can help us adapt, help us cope, and focus our energy. Interpersonal communication are interactions between the two or more people, and the verbal and nonverbal messages are sent and received during each interaction. We know that symbols, language, culture, and behaviors may have an impact on each and every interaction. So for us to have communication, there are 5 elements that are necessary. Obviously, 2 individuals. There's some sort of information or message. There's some answer or feedback, and then there's actually the context of the message. So when we consider communication, what is unique about each of these components in a nurse-patient or nurse-client relationship? Our relationship is more analytical with our patients, and as a nurse, we want to help our patients make specific changes in behavior or attitude. So there are some theories of communication. Florence Nightingale believed that patients need to be understood and communicate effectively with nurses and doctors. Rausch, he thought that communication is a circular process. So messages will travel from individual to individual. And for us, therapeutic communication is something that is used in medicine to help bring about positive changes in an individual. For Byrne, in his theory of communication, he believed that individuals communicate using 3 different personalities: the child, the parent, and the adult. Learning someone's communication patterns makes the nurse able to achieve more effective and better interactions. Patterns that we look for would be eye accessing, so the way people may move their eyes when they're thinking, the patterns of language that are used, as well as the pace and the rhythm of the speech. Healthcare providers are finding that neuro-linguistic programming is a powerful tool that can be used when communicating. Verbal communication is obviously a spoken word. It is something that is verbalized from person to person. It can be received differently depending on the individual that one is communicating with. So nonverbal communication is any type of interaction that is not stated in words. So it might be eye rolling, a smirk on the face, arms being thrown up in the air, clasping of the hands when someone's nervous. We need to realize as nurses that some of our clients may not articulate as well as others. So as a nurse, we need to make sure we understand their nonverbal communication, because it is critical to our perception of what is happening with the individual. For various cultures, their communication styles will vary depending on culture to culture. There will be different behaviors seen. Each culture will have its own value system. Some cultures may have their own language that they speak as well. So therapeutic communication is what we use in the nursing profession. This will help focus on the actual client and help develop that nurse-patient or nurse-client relationship. As a nurse, we know we need to be active listeners. So we're concentrating on the individual that's speaking. We want to make sure that, we're paying attention to our individuals. Sometimes we will use different skills to interact so that way we can encourage a more fruitful conversation, especially if we're trying to obtain a history and physical. To have appropriate therapeutic communication as a nurse, you have to be accepting of the individual and show interest in what they're saying. Nurses need to be respectful and honest. They need to provide a sense or a point of concreteness. So if something's not being understood, or you feel the individual's trying to say something and they're not able to determine, you can always say, "This is what I heard you say," and repeat to them. We will need to ask permission to communicate with others outside of the nurse-client relationship. It is a very protected relationship that we have with our patients, because trust is something that comes into the therapeutic relationship. Using good therapeutic or active listening skills, we need to make sure that there is nothing between us and the individual that we are speaking to. So sometimes you may need to turn off the television, right? We're watching how people communicate non-verbally. We are using eye contact, and we're watching our patients or our clients' eye contact and their body language. As a nurse, we should never interrupt. We may have a pad and a pencil, and we may take a few notes to help us remember or cue things into our mind. And we want to make sure that if we are not understanding, or even if we think we do understand, we should clarify with the client to make sure that we are getting that good communication between the sender and the receiver. Considering interaction between the nurse and the client, we want to make sure that we don't use any questions that begin with the word why. If you stop and think about it, why did you do this? It puts the patient on the defense right away. And that is not conducive to a therapeutic relationship with anyone, be it patient or client. We want to make sure that we know how to respond. So sometimes just saying, "Okay, I understand. Can you go on? Go ahead and go on," and give them that opening to continue with the conversation while the nurse is still showing that they are interacting and showing interest in what the patient has to say. So non-therapeutic communication is obviously not going to be helpful in the nurse-client therapeutic relationship. There are barriers to communication. When you think about someone getting angry, you think about someone who won't talk to you, won't share information. Those are barriers to communication. Sometimes those can be used when the client actually feels threatened or the environment to them feels threatening. So as a nurse, we need to make sure that we are very empathetic and we use good therapeutic communication techniques to help our individuals. If you, the nurse, or you happen to notice that there is a problem, we can help the individual explore avenues to help resolve the actual problem that they may be having. When we're talking about communication with mental health, nursing needs to make sure that there is trust built between the client and the nurse. This will help gain respect for the nurse, and it will also be shown to the client. So by giving the patient or the client time to express themselves, showing empathy and a level of caring will help establish trust and respect, and it will actually determine the nurse-client relationship.